Are you a woman over the age of, let's say, 45, and you're having joint pain or body ache, stiffness, and you're just not quite sure where this came around or why it came around and where it came from? Well, we're going to talk about something in particular for women in this middle age range who may be having these symptoms. And we're going to explain what it is and what to do about it. And just bringing people's awareness to it could be quite empowering for you. So I'm going to share a little story of myself that happened about a year ago. I had been running. Always been a runner. I was lifting weights. I was eating well, doing all the things that we talk about. Anti-inflammatory diet, felt amazing. And I ran the half marathon in Boston with my daughter. And right after the marathon, my periods halted. Now, I'd had some perimenopausal symptoms with some fluctuations. But what really was devastating to me was when my joints just started hurting, especially the outer part of my hips. And I could not figure out what was going on because I'd already trained, significantly. I had a great run, and I just couldn't figure it out. It was like I suddenly felt 100 years old. Well, I started diving into all the symptoms of menopause, being that there's well over 30 plus documented symptoms of menopause. One came across my radar that I was less familiar with. And that's what we're going to talk about to you today. And that is where literally I've decided just to take on the menopause cause and just share as much information as I can about it, because walking into from that perimenopause state to entering into this menopausal state was life changing for me. It was quite devastating in the beginning, but I've used it as a kind of as a butterfly changes, a caterpillar changes to a butterfly. It's just really honed me in on being mindful about symptoms, where I need to be doing more research and sharing with women who are, most of my patients are my age, and really looking at what we can do and what does the research say that we can do, either lifestyle intervention wise or with more medications of those who choose to. But let's go deeper into what could be causing these horrible joint pain. I mean, guys, it was bad. It's better now, certainly much, much better. I'm starting to run again after almost a year without running. But I will tell you, there are some things you can do to make it much, much better. But holy moly, it threw me for a loop. Well, we're going to talk about it now. So remember, menopause is a natural phase, right, in our lives. It just marks the end of your reproductive years, but it's also commonly associated with hot flashes, mood changes, difficulty sleeping, all those things. But fewer people are aware of its impact on your musculoskeletal health. So this is called the Menopause Musculoskeletal Syndrome, right? This refers to the range of musculoskeletal symptoms that women may experience during and or after menopause, including joint pain, muscle weakness, and increased risk of osteoporosis. We're going to talk a little bit more about the causes, the symptoms, and effective management as we navigate this component. And I'll tell you, there's nothing like joint pain when you didn't have any before. It gets your attention. So first of all, what is it, right? Basically, the Menopause Musculoskeletal Syndrome encompasses a variety of symptoms. It affects muscles, bones, and joints, okay? Those symptoms are primarily linked to the decline in the estrogen levels that occur during perimenopause and menopause. Especially during perimenopause, you get these fluctuations. But then after my race, I said sudden drop because my periods halted. That was me entering into the menopausal phase. Estrogen plays such a crucial role in maintaining bone density, muscle mass, and it's anti-inflammatory. So when you see this reduction, you can have several musculoskeletal issues. So common symptoms include, again, that joint pain, stiffness, muscle weakness, reduced flexibility, and heightened risk of fractures due to decreased bone density. One other thing I want to highly mention is in the description below, I have a free menopause symptom questionnaire. If you want to download that for free, you can grade where your symptoms are, and it will kind of tell you the severity of your menopausal symptoms and maybe some suggestions on what you should be doing about it. So that's just a free resource for you if you want it down below. And please subscribe to the channel. Sorry, I forgot to mention that. But let's keep going. So let's go a little bit deeper into the symptoms of the menopause musculoskeletal syndrome, right? So one is joint pain and stiffness. So many women experience the joint pain like I did, especially in the knees and the hips. I couldn't even lay on my side, you guys. It was so horrible. I didn't have so much in my hands, but certainly some women can. And it can be due to thinning of cartilage, reduced lubrication. It can be, again, increased inflammation because you have this sudden lack of estrogen. And then also you can get what we describe as muscle weakness, right? So remember, the loss of estrogen, especially over time, you can see a decline in muscle mass and strength. So making daily activities even more challenging. So like where I used to have great flexibility, or I'd say great, I would say better flexibility, suddenly it became much worse. Like I'd get up out of a chair and I was like hurting. I was like, what is going on? Anyway, next is bone density loss, right? So osteoporosis, especially around the perimenopause time frame, you get this really rapid decline in your bone density. But osteoporosis is a real concern during menopause, right? Because we don't know where you were at age 30. Like that's usually typically when we stop adding to our bone density, or like our bone bank, I like to say, right? So was your bone bank full at age 30? I don't know. We don't talk about bone health with our young women. I don't know why. But we also don't go and do testing, right? We don't know if someone has an increased risk because maybe they're entering into middle age with already a lower bone density. So now we throw in the flux of perimenopause and menopause, and we can see an accelerated loss, and we can see an increased risk of fractures. So something really important to pay attention to and think about, and speak to your doctor about. Maybe some DEXA scan would be appropriate for you if you have any increased risk, which I've done an entire thing on osteoporosis. I did a whole masterclass on it. Plus, you get all of my little master classes for free with all the ebooks when you join the Healing Kitchen, which is at drmarbas.com. We meet every Wednesday live, answer all those medical questions. Anyway, check that out if you're interested in what to do for osteoporosis. But then again, is this reduced flexibility and also balance, right? So when you get decreased muscle mass and joint stiffness, it can lead to that reduced flexibility and balance. That can increase risk of falls, when coupled with an increased risk of bone thinning or osteoporosis, leads to the possible fractures, which really can be debilitating on the long term. All right, so let's talk about a little bit more about the cause. Again, the most primary cause of this is the decline in estrogen, because it's so important for, again, all of those things, maintaining muscle mass, maintaining your bone density. So when estrogen levels drop, your bone resorption increases, meaning the bone breakdown increases, and then that leads to an decrease in your bone density. So remember, the bone is a living, dynamic organ. Think of it that way, right? Okay? There's building and there's breakdown. That's just that balance that you want to keep. The body's always seeking balance. So when the estrogen is suddenly gone, now we have decreased inhibition of that bone resorption. And so now with that bone resorption or breakdown will increase, putting things out of balance, which puts you at higher risk of osteoporosis, right? And so the estrogen, again, has that absolute direct effect on muscle mass, muscle tissue strength, and it can result in muscle atrophy, weakness, or what we call sarcopenia as we get older. And then, of course, estrogen is important for cartilage, which is kind of cushions your joints. That can lead to thinning cartilage and causing joint pain, stiffness. And remember, estrogen is anti-inflammatory, so you can see an increase in certain inflammatory markers with the decline of estrogen. All right, so there's other contributing factors, right? So if you already have decreased physical activity, poor nutrition, and other lifestyles changes, that can also worsen the menopausal transition. But I will tell you, even if you're doing everything right, according to the research, like I was doing everything right, guys, at least according to everything that I've studied all the time, I still suffer dramatically. So don't feel bad if you're like, man, I'm not doing everything well and I'm still suffering. I'm just saying that even for those of us who are really trying to do everything right, you can still have symptoms, and that's okay. It's just something to be aware of, okay? So what should we do to manage this? Well, I'll tell you what I chose to do, but I'm going to jump into lifestyle modifications first, and then we'll get into the medical interventions, which I chose to embrace, and I feel like a different human And I'll explain that in a second. But lifestyle modification, one is regular exercise, right? So engaging in that weight bearing and resistance training exercises are so important. So what is weight bearing? So let's say that you're walking, you put something heavy on you. Like when I was at the airport last week, I was walking with, I swear it's a 25-pound backpack. That is my osteoporosis training. So that's what we call weight bearing. Now resistance training is moving something heavy regularly. In a program that you do what we call progressive overload, where you're starting to either increase reps, sets, or weight. That's something there. It's, again, if you already have a risk factor of osteoporosis, you want to make sure a physical therapist or your physician is aware of that you're wanting to incorporate strength training, and make sure that you're doing it in a very careful manner so you don't cause a fracture. Next is a diet, right? An anti-inflammatory whole food plant-based diet is fantastic. We want to make sure that we're really focusing on those protein-rich foods to help support your muscle mass as you're maybe incorporating some more weight resistance training or weight bearing and resistance training. But also make sure you're eating all those delicious foods that are rich in soy because they have great calcium, and make sure your vitamin D level is at least 30 on those lab tests, but probably 40 to 60 is kind of the sweet spot. These are really important. So vitamin D, remember, helps you absorb calcium, and you also want to make sure you're getting really good magnesium. Magnesium is also a good part of that vitamin D. So again, soy products are fantastic for one, it's phytoestrogens. Did a whole thing on soy. I'm not going to go into it here. It's very good for you. There's no evidence showing that it's negative or poor for you unless you're allergic. It's great in protein, great for cholesterol. That's a whole nother thing that happened with me with my cholesterol going up, but then it came back down when we got to this next piece. But anyway, soy is great for you, good protein, and make sure you're, again, getting all those dark green leafies, and some of those fortified foods will help also with calcium. So like, let's say you do tofu and make sure it's calcium set. The more extra firm tofu will have more calcium because it takes a little bit more of the calcium to actually set it. And next, I think, is something that we all probably is one of the first things to go is sleep, right? So quality sleep is so essential for muscle recovery and your overall health. So we really want to aim to that 7 to 9 hours of sleep per night, really to support our overall well-being. But it can also help, again, recovery when you're doing more exercise and things. So there's so much that sleep does and messes with our hormones. But next is medical interventions. So hormone replacement therapy is now called menopausal hormone therapy. It absolutely is a game changer as far as alleviating symptoms that you can get. One, hot flashes and the musculoskeletal symptoms that I've been discussing. But again, you do want to speak to your doctor about it, make sure that you're an appropriate candidate for it. The newer research is very promising about helping with, one, decreasing risk of a variety of things, including osteoporosis, heart health, brain health, all these different things. I will tell you, my sleep got so much better after I started MHT because I didn't realize that during my perimenopausal frame, because I'll be 54 next month, for those of you who don't know, that fluctuation that had occurred in my mid to late 40s, I just thought I was a light sleeper, especially after years of not sleeping as well as I should because I was, a physician. I am a physician. I just thought I was a light sleeper, but now I sleep like a log. I was like, wow, okay. I just need a little more estrogen, I guess. But anyway, again, supplements may be appropriate as well, like your vitamin D. Make sure you're getting your B12 if you're a plant-based eater. You might want to do some algae omega-3s. Those are great anti-inflammatory, great for bone and heart health. Next, there are some alternative therapies that could be very helpful, like acupuncture, yoga, tai chi. And again, sometimes physical therapy might be really important. And this is where I'd like to get into some of the other things that I'm utilizing to help deal with the hip pain, not doing as much as I should. I need to do more of this, but it's mobility training. So it's kind of like taking flexibility and resistance training and combining them a little bit. But you're just basically strengthening your joints at the end of their movements. And it is quite phenomenal for helping with any type of joint pain, back pain, hip pain, your range of motion. You feel stronger. Again, something to consider is mobility training. So what can you do to prevent this? Let's say that you're kind of in this perimenopausal phase, or maybe you're a younger woman. You're like, gee, I don't want to deal with this. Well, I say a certain things, really focus in on those lifestyle habits, right? So making sure you're getting the exercise, dealing with your stress, focusing on good sleep habits. And again, making sure you're eating that really healthy anti-inflammatory diet. Now, it doesn't mean you're going to be perfect every day, but trying to get more fiber. We are such a fiber deficient country, at least in the United States. The more fiber comes with more whole plants. So that's a great way to start. So if you can aim minimally 25 grams of fiber per day. If you can get closer to 50 or above, that's even more fantastic. I average probably around 75 grams of fiber a day. I eat beans like they're going out of style. I have since I was a kid. We just grew up on beans, tons of beans. So good for you. Great sources of protein. So anyway, start with that. Again, if you are over the age of 50, you might want to consider, especially if you have some high risk, a DEXA scan for your bone density. And yes, I know some other doctors in the space are saying, no, you don't need it. I beg to differ. As a physician who treats patients, who sees patients and sees the devastation with patients who have osteoporosis and falls and fractures, more data, more understanding about what's going on in your body. There's nothing wrong with knowing what's going on with your body, guys. Yes, you need to look at it in a very, holistic way and really decide what's right for you. But at the end of the day, there's nothing wrong with knowing more about what's going on in your body. If that's lab tests or if that's imaging, I'm all for it. One, it might motivate you to be more proactive. Otherwise, or it might be more satisfying to know that what you've been doing is actually working. So don't ever let anyone shame you into not doing or doing tests. This is really up to you. This is your life, and you should decide what you want to do with it. But at the end of the day, one big lesson that menopause taught me was that I really should utilize this time as literally a time of inner reflection and metamorphosis. There we go. Because we are so good at neglecting our health for so many years because we're serving our families, we're working, just doing so much. And we neglect our mental health, our emotional health, our spiritual health, our physical health. And I say, stop it. Menopause and perimenopause, it's a time it tells you, hey, pay attention. I'm going to make you so uncomfortable that it's going to force you to turn around and look inside and say, what am I doing here? And use this as a wonderful opportunity of self-reflection and love and just taking care of yourself, because nobody who loves you wants you to suffer. And putting yourself on the back burner is not the way to make it through this life. I promise. It's not. So there's that. A little tidbit for the day. I hope you guys found that helpful. I'm so thankful for you being here as usual. Again, I so appreciate all of you and sending you joy, love, and healing and more of this. But there's a question here. Someone did ask, what's my view on a low dose testosterone for postmenopausal women? I think it has its place. I still have a uterus, so I'm on estradiol patch, which is important. That is a bioidentical hormone. It's a prescription written by a regular doctor. Pick it up at your pharmacy. It's FDA regulated. It's not compounded. And I have to use micronized progesterone because I do have a uterus. That will help protect my uterus from endometrial cancer, because what happened is the estrogen tells the inside lining of your uterus, grow, and the progesterone goes, no. But anyway, I was trying to be funny. But there's that piece. But in some women, though they may have, let's say, decreased libido or quite fatigued, and a low dose, maybe the 1/10 the amount that men get, is what women would potentially need, especially if they're having some type of low libido. And I think it absolutely could be appropriate, but not necessarily for everybody. And again, it's just a discussion you should have with your doctor, looking at your risk of everything. And you may decide that you don't want to incorporate HRT, but it absolutely should be on the table for discussion for intervention. And again, I'm all about lifestyle. You guys know that's all I've ever said. And I have said that lifestyle interventions are greater than any prescription, and I still believe that wholeheartedly. But when it comes to a rapid decline in your estrogen and your suffering, it has its place, and the majority of women could benefit from it. So, and how long should I stay on it? I'll probably stay on it as long as I can until someone tells me, Laura, you're hurting yourself by doing that, and I see the data. So I am in no way, shape, or form wanting to go through that again. All right, guys. I hope you found that helpful. Try to be as transparent as always. But yeah, if you are finding that you're still low energy, still having low libido, and you are an HRT, one, either increasing your dose of the HRT or adding that low testosterone may not be a bad idea. But there could be other things too. You definitely want to keep looking into that, making sure your sleep's good, all those different things. So whole host of things you could do. So I'm going to just tackle one thing at a time. I could keep talking forever, but again, thank you guys for being here. I'm going to go jump into the Healing Kitchen, which we have tonight, which is my friend Brittany Drudy. If you would love to meet live with us every single Wednesday, plus all the workshops and ebooks that I offer, go on over to drmarbas.com and check out the Healing Kitchen. It's a low-cost membership, and we just have a blast in there. You have access to all the recordings. We're well over a year now. You have access to all of those from the last year, and sometimes we even get a little presentation from Brittany's new baby. And so, yeah, so there it is, guys. Again, have a beautiful day and a safe and restful rest of your week, and don't forget to embrace menopause, because it actually could teach you a lot of lessons like it did me. So, all right, guys. Oh, and by the way, probably next week, I will be launching my Menopause Masterclass. So it's Master Menopause and Feel Fabulous. It is going to be close to a 200-page ebook with a course, and we meet twice a month together for a full year. Yes. And I am so excited about this. I put my heart and soul into this thing. But anyway, be on the lookout for it. If you join our email list, you'll be first access to it. And again, thanks for being here, everyone. We'll talk soon. Bye.